Disclaimer. Site, regardless of date, should ever be used as a substitute for direct medical advice from your doctor or other qualified clinician. Pain. Everyone experiences pain at some time. It might be the result of an injury, operation, or pushing your body too hard. Headache, infection, arthritis, and other health problems cause pain. Unchecked, pain can rob you of the ability to sleep, work, and enjoy life. It can also lead to depression and anxiety. We've come a long way from the days of grin and bear it, or no pain, no gain. Pain begets pain, so it's important to stop it early. There is no one-size-fits-all approach to pain relief. Standard medications can be a good option for many pain sufferers, but a wide range of effective non-drug therapies are also available. Relief for sore backsides. You can ease the pain of sitting too much by getting up and moving around. Try these stretches and exercises. An excessive inactivity isn't just bad for overall health, it can literally be a pain in the butt. You could end up with a sore backside if you sit at a desk all day long, if you're confined to a wheelchair, if you sit on hard surfaces for long periods, or if you're simply not as active as you once were. Whatever the reason for rear end pain, it's time to stand up and get a little relief. What's causing your pain? When you sit in a chair, you're resting on your ischial tuberosities, or sit bones, the bony prominences at the bottom of your pelvis. You're also placing lots of pressure on your lower back, nerves, muscles, tendons, and ischial bursae, fluid-filled sacs near the ischial bones. Sitting can aggravate, or in some cases cause, these common sources of buttocks pain. A bulging disc. When you have a disc between the bones of your back that bulges out and pinches nerves, sitting can make things worse. The pinched nerves can cause pain that travels down to the buttocks, says Claire Saffron Norton, clinical supervisor of rehabilitation services at Harvard-affiliated Brigham and Women's Hospital. Ischial bursitis. One or more of the ischial bursae become inflamed and cause buttocks pain. Unhealthy hamstrings. The hamstrings, 3 muscles in the back of each thigh attached to the ischial bones by tendons. Sitting for long periods may shorten the hamstrings, increasing the risk for hamstring strain or tendon irritation that you'll feel in the buttocks. Piriformis syndrome. Too much sitting can overstretch the piriformis muscle, deep in the buttocks, which may irritate the sciatic nerve running through the piriformis and cause pain in the buttocks or down the leg. Ease your pain. If you're experiencing buttocks pain, Saffron Norton recommends that you stand up and move for a few minutes every hour. March in place or walk around for a few minutes, and then do some of the following exercises and stretches. You can do the entire routine or do one exercise per hour. Standing back bend. Stand up straight and place the palms of your hands on your lower back, fingers pointing down to the floor. Lean backward just a little. As you do, press your hands against your back to support it and squeeze your shoulder blades together. Hold for a few moments and return to your starting position. Repeat up to 5 times. This stretches the stomach and may help to reduce the size of the bulging disc, Saffron Norton says. Hamstring stretch. Stand in front of a staircase or low stool. Put one foot on the lowest step, or the stool, and lean forward at your hip until you feel a stretch in the back of the thigh in your standing leg. Hold the stretch 20 to 30 seconds. Repeat 3 times, then repeat the stretches with the other leg. Standing plank. Stand in front of a countertop. Place your forearms on the counter and then walk your legs back a step or 2. With your feet together, lean forward, keeping your back straight and your belly pulled in. Hold the position for up to a minute and return to the starting position. Repeat the exercise if you can. This will help you strengthen your stomach and back muscles, which will support you while you're sitting, and keep you from slouching and overstretching your muscles, says Saffron Norton. Piriformis stretch. Lie on a bed or a mat on the floor. Use your hands to pull your right knee up toward your left shoulder until you feel a stretch in your buttocks. Hold the stretch for 20 to 30 seconds. Keep your left leg straight. Relax, then repeat the stretch. Then switch your leg position and pull your left knee up toward your right shoulder, keeping your right leg straight. Hamstring stretch lying down. Lie on your back with your knees bent and feet flat on the floor. Grasp your right leg with both hands behind the thigh and pull it toward you. Extend your right leg to lift your right foot toward the ceiling. Straighten the leg as much as possible and flex the ankle to stretch the calf muscles. Hold. Return to the starting position, then repeat with your left leg. What else helps? When you're sitting for long periods, use a seat cushion to soften the load on the bones. But keep your hips higher than your knees, Saffron Norton says, so you don't overstretch your hip muscles. Use another pillow for lower back support. Put something behind the small of your back to create a little arch and keep your spine from shifting too far, Saffron Norton says. And make an effort to limit the amount of time you spend sitting. Aim for more activity throughout the day, which has been shown to help health in many important ways. Will my herniated disc heal on its own? I have a herniated disc in my back. What does this mean, and will this heal on its own? A herniated disc, also called a slipped or ruptured disc, is a common problem that can happen at any age, but becomes more common in middle age and beyond. It occurs when the jelly-like filling in a spinal disc, one of the pads between your vertebrae, or spinal bones, breaks through the disc's outer shell, called the annulus, and bulges through the tear. When this happens, the material may press on nearby nerves, which can cause a host of symptoms including inflammation, pain, and numbness. Where in your body you experience these symptoms depends on the location of the herniated disc. For example, if the disc is in your neck, you may feel pain down your shoulder and into your arm. If the disc is lower in your back, it may irritate your sciatic nerve, which can cause pain that radiates through your buttock and down your leg. The good news is that in most cases 90% of the time pain caused by a herniated disc will go away on its own within 6 months. Initially, your doctor will likely recommend that you take an over-the-counter pain reliever and limit activities that cause pain or discomfort. But in some cases, if you've been using these strategies and haven't noticed an improvement, your doctor may recommend further evaluation and possibly an additional treatment strategy, such as physical therapy. Surgery is typically not recommended unless the problem does not respond to therapy, if you are having an increasingly hard time moving, or if your doctor believes the spinal cord is being compressed. By Tony Gallen, MD, and Hope Ricciardi, MD. Editors-in-Chief, Harvard Women's Health Watch. Five Internet recommendations for joint pain. Do they work? Some ideas seem reasonable, but that doesn't mean they'll help. People increasingly consult the internet about medical problems. If you're looking for approaches to relieve joint pain and inflammation caused by wear and tear, osteoarthritis, or an immune system attack, such as occurs in rheumatoid arthritis, you may find methods that sound promising and even sensible. But will they work? Here's advice on 5 pain relief methods commonly touted on the internet. 1. Music therapy. Listening to music can evoke powerful emotions that help people relax or heal, which is the basis of music therapy. Research has found that music therapy is associated with less anxiety before surgery or during chemotherapy, and better functioning during physical rehabilitation. Will it help joint pain? Listening to music could provide an appealing distraction, so you might not focus as much on pain, stiffness, or physical limitations. Some studies have paired it with physical therapy, dancing, or other movement and found some evidence of psychological benefit, including improved mood and reports of reduced pain, says Dr. Robert Schmerling, a rheumatologist with Harvard-affiliated Beth Israel Deaconess Medical Center and a senior editor at Harvard Health Publishing. 2. Sleep. Not getting enough sleep can have a big effect on pain. People feel pain more intensely when they don't sleep enough, Dr. Schmerling says, and significant joint pain can interfere with sleep. So it can create a vicious circle. Inadequate sleep also increases your risk for obesity, high blood pressure, heart disease, diabetes, and even premature death. Will it help joint pain? By itself, getting more sleep probably won't reduce your joint pain, Dr. Schmerling says. But you should try to get between 7 and 9 hours of sleep, regardless of whether you have arthritis. 3. Therapeutic massage. There are at least 80 different types of therapeutic massage. Will it help joint pain? Gently rubbing the joints may increase blood flow to the affected areas and ease sore spots. But it won't last. Massage can make sore muscles, tendons, and joints feel better, at least temporarily, but it is not a standard treatment for arthritis, and it has not been proven to have an anti-inflammatory effect, Dr. Schmerling says. The more joint damage is present, the less I suspect massage might help. 4. A high-fiber diet. Eating a high-fiber diet, rich in vegetables, fruits, whole grains, and legumes, is associated with many health benefits, including better control of cholesterol, blood pressure, blood sugar, and weight, lower risks for developing diabetes and dying of cardiovascular disease, and less constipation. Will it help joint pain? One could speculate that perhaps a high-fiber diet can help with loss of excess weight, which can reduce osteoarthritis symptoms in weight-bearing joints. Or perhaps a high-fiber diet can change gut bacteria, and that might alter immune function in a condition such as rheumatoid arthritis and might lead to improved symptoms. But otherwise, it's not clear that there's a biologically plausible way a high-fiber diet might help reduce joint pain, Dr. Schmerling says. However, a high-fiber diet is recommended for good digestive and overall health, so I endorse it, but not for any known benefit for arthritis. 5. Meditation. Meditating elicits the relaxation response, a well-studied physiological change that can help lower your blood pressure, heart rate, breathing rate, oxygen consumption, adrenaline levels, and levels of the stress hormone cortisol. Will it help joint pain? I know of no convincing evidence that meditating can reduce joint inflammation. However, it can serve as a way to focus on something other than pain, stiffness, or physical limitations, and it can lead to a reduction in perceived pain. There might be a benefit similar to listening to music. It might improve mood and reduce stress, Dr. Schmerling says. It's also possible that meditation could lead to pain-relieving chemical changes in the brain, but this is unproven. A final word. You have nothing to lose by trying any of the methods we've outlined, except the cost of massage or professional guidance for the other approaches. But be realistic about how these options might affect your arthritis. And make sure you've talked with your doctor about standard arthritis therapies, such as physical therapy, corticosteroid injections, and medications. Easing the ache. Osteoarthritis pain can be debilitating. Strategies can help get you moving again. Pain from osteoarthritis is more than just a nuisance. Knee pain, in particular, can not only keep people from exercising, but also have a chilling effect on their ability to participate in social activities, especially those that involve walking or traveling, says Elena Luzina, the Robert W. Lovett Professor of Orthopedic Surgery at Harvard Medical School and co-director of the Orthopedic and Arthritis Center for Outcomes Research at Brigham and Women's Hospital. In fact, the quality of life of a person with persistent pain due to knee osteoarthritis is similar to quality of life in women with metastatic breast cancer controlled by therapy, she says. Arthritis can produce a range of symptoms from pain to stiffness. The patterns of pain differ from person to person, but it often comes in waves or flares, says Luzina. Also, evolving data show that while pain may fluctuate between flares, a relative minority 10% to 15% of knee osteoarthritis patients experience a steady worsening. Arthritis symptoms and causes. Osteoarthritis is the most common type of arthritis, affecting nearly half of all Americans over 65. It results from the deterioration of the cartilage that acts as a cushion between the bones in a joint. A number of factors can cause cartilage to break down, including general wear and tear from friction and pressure on the joint over time, injuries, and even your genes, as osteoarthritis tends to run in families. Obesity is also a risk factor for osteoarthritis. As the cartilage padding wears thin, the bones begin to rub together, causing pain and in some cases spurring an overgrowth of bone as it attempts to heal. All this can lead to inflammation and tissue damage in the surrounding area. Symptoms of arthritis typically develop over time and may include pain and swelling after activity, joint stiffness in the morning, a grinding sensation with movement. Life with osteoarthritis. Living with arthritis pain can be a challenge, but there are numerous strategies you can use to manage it. There is not yet a treatment that can reverse the underlying joint damage caused by osteoarthritis, Luzina says, although several pharmaceutical companies are pursuing disease-modifying agents. Current treatments for osteoarthritis instead focus on relieving symptoms. They fall into 3 categories. Nondrug therapies. These include exercise, one of the most effective treatments currently available, and physical therapy, says Luzina. Regular exercise can reduce stiffness, pain, and fatigue. But it can be a challenge to get moving if you aren't exercising regularly already. Try starting off slow, with simple activities such as regular walks. Drug therapies. Doctors often treat osteoarthritis with nonsteroidal anti-inflammatory drugs, which relieve swelling and pain. Examples include ibuprofen, Advil, and naproxen, Aleve. There is also evolving research on the role of the antidepressant duloxetine, Cymbalta, and muscle relaxants, says Dr. Luzina. A strategy that has come under scrutiny in recent years is the use of corticosteroid injections to treat pain. This treatment, in which a doctor injects a strong anti-inflammatory medication into the joint, is often used to temporarily relieve pain in people who aren't responding well to other medications or non-drug strategies. Recent data suggest that pain control from corticosteroid injections is limited to the short term, says Luzina. These injections may actually lead to more damage to the joint. This means that while you may alleviate pain in the short term, you're making the joint worse in the long term, which could make it harder to control symptoms over time. Surgery. Joint replacement is sometimes an option for people who aren't seeing success with other strategies. A total knee replacement, for example, can be used to alleviate pain for people with severe knee osteoarthritis. It is shown to be effective, leading to substantial pain relief in about 4 out of 5 recipients, says Luzina. Having this procedure can help many people with severe osteoarthritis regain function in their joint. The replacement can last for 15 to 20 years. To find the best treatment for your condition, you should discuss your options with a primary care physician or a specialist, such as a rheumatologist, physiatrist, or orthopedic surgeon.